Hello and welcome back to the podcast. I'm your host, as always, Ian Lewins, PEM consultant based in Derby. And welcome back after a break. It's been an odd few months, I think, for everybody involved in healthcare, in paediatrics, with the ongoing pandemic. And I'm very pleased to sort of be joined today by Dr. Simon Clark, who's a neonatal consultant based in Sheffield, but is also the VP for policy at the RCPCH to talk about some of the issues that have kind of arisen during this time. So good morning, Simon. How are you today?
I'm fine, thank you, Ian. It's a delight to be here representing the college, and your podcast is obviously very popular with many of our members, so it's really nice to have the opportunity to chat to you about these issues.
Well, that's very kind. So from my perspective, working in the emergency department in April and May, our attendances, and I think that's reflective of many departments, are down about 50 to 60% on what's normal year on year. And this must be a good thing for us exhausted, tired emergency physicians. It's a good thing, isn't it?
Well, I think that it's a mixed message, isn't it? And that's one of the things that we're very concerned about at the Royal College of Paediatrics and Child Health. The government were very consistent in their message of stay home, that was widely pushed across all four nations of the United Kingdom. And I think there were two responses that came out of that from families and indeed many of the wider population. So there was the behavioural response that people wanted of staying away if you don't need to come, which is a good thing. And then there was a degree of a fear response where people were frightened to come to hospital because there were places where you might catch COVID. And so I think that then that led to a variety of different things occurring within families. And without a doubt, there were some elements where people, and I think being a parent is a fabulous journey that many of us go on. And, my children are quite grown up now, but you're still learning about what you are like as a parent in different circumstances. And I think it's very difficult for many parents with new babies or young children to work out whether what's going on is self-limiting and will all settle down, or whether, in fact, it's going to be a prelude to something else. So I think that quite a lot of folks discovered a degree of resilience that they didn't know that they had, and that's a good thing. But I think a lot of people didn't come and present with their children when they should have done, and that's potentially a bad thing.
Yeah, absolutely. And it was really striking, the real drop-off. And this extended both in children's ED and my colleagues in adult ED. And their numbers were significantly down as well. And everyone's sitting there thinking, where are all the sick people? Where have they gone? And I guess for the college, and for many of us, this was the real worry of, are we going to see children presenting much later and much sicker?
Yes, and I think that the system then, on top of the two responses that I were talking about people developing a degree of self-coping and then this fear response, I think there was also then a system response that then occurred, which also probably exacerbated some of the challenges that families faced about accessing healthcare when they wanted to. So the entire system, changed from, being care not quite as and when you wanted it, but, only for emergencies, all elective care shut down in terms of surgery and outpatients. And then the systems like NHS 111 or NHS 24 if you're in Scotland, were then, and I'm hesitant to use the word overwhelmed, but they experienced something like 15 times the call volume or more than they were used to, and the wait times went up significantly on there.
Yeah.
And then, of course, children weren't having the same symptoms as adults with COVID. So children who were being feverish and having a cough, well, there'll be a variety of different reasons for that. And they were then being channeled down, this is probably COVID, you don't need to go in and stay home, stay away. And quite a lot of those children will have had a self-limiting intercurrent viral illness that will have then settled down. But of course, some of them actually were directed to the wrong channel, or at least there's a suggestion that's maybe what have happened, and therefore that's led to some potential delay in their presentation. And I guess combine that with the fact that out there in primary care, there was a huge amount of pressure as well, and our primary care colleagues are extremely effective and efficient. But we all recognise that, and I say we all, both the Royal College of General Practice and the Royal College of Paediatrics recognise that training to become a general practitioner, there probably should be more paediatric experience within that time period for all general practitioners. So they're then dealing with lots of anxious and agitated adults, and then families with young children who are concerned. So there was worry that there'd be a little bit of misdirected care in the beginning. And I think that there's now some anecdotal information that's come out that kind of supports that.
Right. And it was noticeable, actually, particularly on social media, that the paediatricians were sort of starting to go, okay, well, where are these children? We are now getting a bit worried. And lots of departments and the college again put out sort of saying, we are here for you if you need us. Do you think there was a bit of a danger of a mismatched message with the government saying stay at home and us saying come and see us?
So I guess, I don't know, I don't guess actually. I think that in the sorts of events that we've been through, there is always going to be a tension between the clarity of message that you can achieve that is easily digestible within a 30-second government-funded advert on primetime television, and the complex reality of modern existence and what that means for families, children, and other things. And so the college was engaged with lots of meetings through a variety of different connection media with the government agencies, be that NHS 111, be that NHS England, the chief medical officers. There were lots of meetings that were occurring in a variety of different times and not places, but all out in the internet, where we were saying, well, actually, this message needs tweaking because people are staying away. And we were very consistent in saying you need to nuance the message and you need to emphasise that the NHS is still open for business and that families should come. And in fact, after a period of time, at one of the Downing Street briefings, they actually stood up and say, we're still open for business. So if you're poorly, come. And actually, they extended that across the entire age range to include people who may be at risk of having strokes or heart attacks, as well as down to children. On top of that, the RCPCH actually put out a poster specifically designed to try and help parents work out whether or not they should seek medical care. That poster consisted of kind of green, amber, and red types of conditions to try and get families to then come and seek healthcare access.
And this is sort of something that we, college and RChem and everywhere is kind of trying to push for years and years and years to get people to access the right care in the right place at the right time. And this I guess has been a real challenge over this period. In terms of those concerns, then, has the college been sort of collecting data from units about late presentation?
So yes, we have. I mean, just before I go on to that, one of the other things that we've done and we think that we're going to be successful in doing is actually we think that 111 are now going to start to have paediatricians, more paediatricians or more clinicians, certainly from a paediatric background, available to channel paediatric calls to. We've been trying to advertise for paediatricians who are shielded or recently retired to be used by 111 to aid that algorithm and channeling of the direction of children, about which we're really quite excited because we think that'll help a lot. But
yes, absolutely.
Your question about Are we collecting data? And the answer to that is yes. The college has been looking quite closely at this and trying to get information and trying to make sure that what we're not doing is reporting anecdote and individual cases, which I think is very difficult to pick out because there has always been delayed presentation. So how do we make sure that what we're doing is not just talking about a case there that would have been a delayed presentation even in the pre-COVID era, as opposed to making sure that what we've got is some systematic evidence. So we're utilising the British Paediatric Surveillance Unit. Now, many of your listeners will probably have heard of the British Paediatric Surveillance Unit, but for those who haven't, the BPSU, as it's known, is I wouldn't say an ancient organisation, but it predates the formation of the Royal College of Paediatrics and Child Health. And for those of us who are really old and remember when we were members of the British Paediatric Association and housed at the Royal College of Physicians, there was the British Paediatric Surveillance Unit set up to look at rare and emerging diseases. And it's looked at a variety of things over the year, ranging from the incidence of canicterus, Creutzfeldt-Jakob disease, congenital rubella, and a variety of other conditions. And they've looked at things to try and work out exactly what's going on. So they've got several studies running, one looking at COVID in new babies, newborns. But we also did a survey, a snapshot 2-week survey across the UK of delayed presentations to specifically look at children who've turned up late to healthcare and try and work out whether those cases really are delayed presentations and what they're delayed related to. Clearly, quite a lot of information has come into the college for that, and it's going to take quite a while to sift through that. And the British Paediatric Surveillance Unit have a very specific methodology to make sure that they get rid of all the duplications of cases and to ensure that all of the cases are clearly, defined, and the publication of that will be coming out hopefully in the next few weeks or maybe months, depending on how much data and time it takes to clean and present the data.
Yeah, and that's going to be really interesting, isn't it?
Yeah.
I think one of the challenges with that is who's deciding that this is a late presentation. And is it the physicians deciding it, and then kind of discussing with the parents? Because I guess if you say to a parent, "Why didn't you come sooner?" there's going to be an awful lot of worry and guilt associated with that, isn't there?
So I think the way that the BPSU are running the survey is if the healthcare individuals were concerned that this was a delayed presentation related to the COVID experience, that they could then report that. And then they have a systematic way of going through the case in order to ascertain that. And I think we trust our paediatricians to have a deftness of language and interpersonal skills to have those slightly tricky conversations with families. And in fact, I think many families would probably volunteer that they didn't want to bother the National Health Service. Our children and young people's group have been, we've been really busy talking to them as well during this time, which is led by Emma Sparrow at the college. And in fact, I think she'd be a great person for you to chat to at some stage to talk to about their experiences. But that a lot of them didn't want to bother the health service. They didn't want to be a burden. They didn't want to make things more difficult or tricky. And so, in fact, I think people have been volunteering that we didn't come sooner because of this. So I don't think it's been a challenge to gather the information from the families.
Okay.
We're also collecting research, which we're currently calling our temperature check. I mean, it's not the best name in the world, I'll acknowledge that, but we struggle to think of something else to call it, about how units are doing. So the workforce team, who normally collect the census data, put together an online platform for the clinical leads to report their staffing, their degree of busyness, and the amount of personal protective equipment that was available, and within there's an ability to report, how busy the units are and whether they're seeing more or less activity. So that's another way that we've been tracking kind of the activity level across the units of the UK.
Okay. I don't know if you know at the moment, but are you getting a sense of the groups that have presented late in terms of things like their ages or socioeconomic status, or is it diagnoses that are presenting late? Certainly, on the limited interactions I've had on Twitter with people sort of saying, well, what are you seeing? Because locally, we really haven't seen that much that we would deem to present late. The one group that people were worried about was saying, oh, we're seeing lots of people presenting in DKA who are, new diabetics who, as you say, haven't wanted to worry people because these symptoms of drinking and peeing lots have been going on for a while.
Yeah. So I think this is the risk of where I might be just talking about anecdote, because again, what we're struggling with until we've got the data properly sifted by the BPSU and worked out what would have presented late regardless and what has presented late to COVID. I think you're right. Things like diabetic ketoacidosis have been the things that people have been concerned about. Other things include oncological diagnosis like new episodes of leukemia, and that potentially because children will have been a bit listless or a bit feverish and unwell. We may see that those have presented late. I think we've got concerns about mental health and whether mental health may have particularly suffered in this time. And again, there may be a dual effect where, because of the nature of the crisis, people may have reset their own personal anxiety levels to say, we're all in this together, and so we're going to cope. And in fact, my mental health is slightly better because of this. But equally, in this crisis where people have been forced into close proximity with their family, which could be potentially a source of their anxiety, or they may be just genuinely worried or more anxious because of the crisis that's going on. We may see some mental health things that present late or in a delayed manner. And we've also got concerns about children in the looked after sector as well, because of quite a lot of those elements of healthcare workers were redeployed into the acute sector. And additionally, there's things like safeguarding where we're concerned there may be safeguarding issues which may have presented but then haven't because they haven't sought attention for injuries and other things that they may have done, and children aren't being seen at school. So I think there's a range of areas where there could be delayed presentation, and I think we're hopeful that the BPSU survey and the data we're collecting will tell us where we need to focus on as we aim to restore, recover, and reset paediatric services.
The other group that I've sort of seen mentioned as a concern are children going for immunisations, and a big worry about babies missing their immunisations and delaying the schedule. Again, is that something that the BPSU's been able to look at, or is that more of a primary care issue, do you think?
So I think that's more of a primary care issue, that the government and the Department of Health were absolutely clear that the primary immunisations for babies should have been open for business and should have been occurring. So there should not be a backlog of those. Now, clearly there will be for a variety of complex reasons, because some people didn't offer immunisations because they felt that it was unsafe to. Some parents wouldn't have taken their babies for immunisations because they felt it was unsafe to. But it was absolutely clear that they should have been open for routine immunisations in infancy. I think the immunisations that may cause a concern are the adolescent ones and the childhood ones that were occurring in school. And as a neonatologist, to my utter shame, I'll be failing to mention the specific ones that those are, because it's been a long time since I had to memorize them. But I think those are the ones that are causing us a concern that, if they haven't had those later childhood immunizations, that we may see some of those diseases, and there needs to be a catch up of those once schools are fully back.
Thinking about this, the sort of the BPSU data, how confident are we that we're going to capture what's been happening? I am aware that there are sort of other groups, including Peruki, who are sort of trying to capture this as well. Is there any sort of coordination between the college and other potential groups trying to look at this data?
So, the fascinating thing about times like this is that you always get a degree of more collaboration than you're anticipating, but also there's a frisson of competition that creeps in these things, where some academic departments think, oh, we can now publish this data and collect this data. And the college have worked really hard to try and ensure that collaboration is the thing that's occurring across the institutions, so that we pool resources and try and get a coherent and consistent story out there. Now, I think that there's a real tricky element to that, because if you produce something that's completely coherent and consistent, then what you end up doing is sound like you're spouting government policy. Because we all know that in research and listening and chatting to folks, the whole system doesn't behave in a homogenous manner. Certainly in Sheffield, one of the things that we've noticed is we have a rapid access clinic for babies to come back to with feeding problems and jaundice. And locally, that's been much quieter than it has been before, because, and I'm speculating here, that actually mother and baby pairs are, having a much more, I don't know quite what the right word is, but I'm going to go restful time in this COVID era than they may have been doing in the pre-COVID era. So in fact, the natural rhythm of the mother-baby bond appears to be, reducing the number of babies we're getting turning up with weight loss and reducing the amount of jaundice. Now, interestingly, I was on a conference call listening to some other professionals in a different city, and they were seeing more problems with feeding and weight loss than we seem to be having here in Sheffield. And so I think that it's quite tricky to say, oh, yes, this one coherent truth, and this is it.
Yeah, that's interesting, because that I would say that reflects our local sort of experience of the, we would see lots and lots of these babies, and actually we haven't. What we have seen is a significant increase in things like burns and accidents in the home, and it's sort of looking at the data from that and how we use that data going forward, I guess. In terms of sort of publication, you mentioned maybe a couple of weeks, depending on how long it takes.
So I'm skating on slightly thin ice, because the BPSU sits under the research division of the Royal College of Paediatrics and Child Health, which is chaired by Professor Nick Bishop, who is a good friend of mine and a colleague here in Sheffield, actually. So I can't give you absolute clarity on when that's going to come out, and I'm sorry about that. But I'd be over-promising if I said I know exactly when the date's going to come out, because there is a huge amount of information that they're collecting, and they're also collecting, as I say, three other sets of data about COVID-related issues. And the two main ones are the COVID in neonates, and also looking at the multi-system inflammatory condition.
Yeah. So when this gets published at some point, it's going to be fascinating reading and really helpful if we get the data and actually we show we had a 60% reduction or 50% or whatever in attendances, and actually in terms of adverse outcomes or children ending up on PICU, the difference was negligible. That's going to show that people use A&E services inappropriately, isn't it?
So like a lot of these things, I think behaviour changes and evolves over time. I already alluded to that there may be a degree of parenting skills that people discover that they have that they might not have realised that they'd had. But also, it's about how you access and channel people through healthcare that's really quite tricky. And in modern society, when you're presented with a range of choices and people want instant access to things rather than delayed or booking an appointment, then I think that's the way they were using the healthcare. The question I think that's much more important that we need to ask is there a way that we can then help individuals and families navigate the healthcare sector in the UK and the NHS so that they can still make the choices about getting access to the healthcare that they want when they want, but it doesn't put quite the same amount of pressure on certain parts of the system as there were beforehand.
I think that's really interesting. And I think this is going to be fascinating data for us to look at. And of course, we all hope that we are potentially over the worst. But of course, if we see a second spike, we may be able to use some of this data to plan services further. Simon, that's been really fascinating to talk to you this morning. Thank you so much for your time.
It's a pleasure. Thank you very much for having me. This was a new and novel experience for me. I'm not often in the modern zeitgeist of communication technology, but it's great to be taking part in a podcast.
Excellent. Thank you so much.